Nclex examination. My name is Wasiu Ibrahim, and I will be discussing about the myths surrounding Nclex examination. Yes, it is true to nurture fear and anxiety in our minds when preparing for this important exam in nursing. But I'm here today to disprove these myths so that you can prepare yourself better to achieve your goal of passing this Nclex examination. The first myth is that the new generation Nclex will be beginning in April this year. Though NCSBN is working on the new generation Nclex, which will further test your critical thinking abilities over just memorizing tasks and information. But the truth is that, according to osmosis.org, this new generation Nclex will start in 2023, not this year. The second myth is about SATAs. I know many of us fear SATAs. Select all that applies. Many of these SATAs are difficult, but that does not always mean you are passing above the line. The only advice is that you should become familiar with them. Practice them a lot, but don't perceive them to mean you are passing above the line. Another myth is that you have to memorize all the medications in the world. Oh my God, this is not true. How can that be possible? It is 100% impossible to memorize all the medications in the world. What I will advise you is that memorize the few of most commonly used medications and their most common suffixes. For instance, the INE, amlodipine, nifedipine groups, the INE groups such as amlodipine, nifedipine, the selines such as amoxicillin and ampicillin. We also have the zoles such as fluconazole, ketoconazole, clotrimazole, and the mycin such as erythromycin and the statin groups. Just know the few commonly used ones. Know their collective side effects. Know their collective mode of actions. That is all that you need. You don't have to know all medications. It is not possible. So the fifth myth is that the first time examinees fail. They usually fail. It is normal to be anxious, but do not let your anxiety deter you from your focus of achieving your goal as a first-time examinee. The fact is that most candidates pass the first time according to NCSBN statistics. So another myth that we have to discuss is that if you answer more than 75 questions, that means you are failing. No, that is not true. Many candidates have passed and failed answering questions at 75 or above. It is not the length of exam that predicts your passing or failing. In fact, every question has been analyzed and screened for difficulty, and your responses to each question determine when the exam ends. But you must answer at least 75 questions. at least 75 questions. The sixth myth that candidates have is that once one fails first time, that is the end. No. If you do not pass the Nclex, you have to wait 45 days before you can retest. 45 days before you can retest. Some states will advise the examinee to go for a refresher course or go back to nursing school if the candidate has failed multiple times. The next myth is about the first instinct when you are answering Nclex questions. Observations have revealed that your first answer after reading the question carefully is the right answer. I will repeat it again. Observations have revealed that the first choice that you pick after reading the question carefully is usually the right answer, because you make your decision calmly and rationally. There is likelihood of missing the answer if you change your response. So, these are the commonest myths that candidates preparing for Nclex usually have in their minds. Please and please, you don't have to let these myths disrupt your quest for success. My name is Wasiu Ibrahim. If you want to join our Nclex tutorial, kindly message us at travelnurseconsultancy@gmail.com. And also, if you want to work and practice in the United States of America as a nurse, kindly send your emails to travelnurseconsultancy@gmail.com. Thank you for listening. Bye.